I know you were just telling me people call you all kinds of names.
They keep on modifying.
They keep on modifying your name. I hope I got it right.
You did.
Of course. Thank you so much for joining us. If you listened earlier on and even in the recap now, what are your reactions to what was said about health today?
Yeah, okay. I just want to pretty much agree with most of what the PS has said, because we are seeing a lot of challenges in the health sector today. Although there are quite a lot of initiatives that have been put in place to improve the indicators, we are still seeing a situation where the background, the environment in which we are trying to put in these initiatives is still not able to sustain proper improvement in the delivery of service.
All right. What are your key concerns?
Yeah, already we are seeing a situation where the health workers are heavily overworked. Just against the backdrop of this free maternity care that we are talking about, you realize that the number of health workers is actually reducing in public sector as opposed to what is supposed to be. It is supposed to be increasing. We have started off with a small number of health workers, and then we have introduced free maternity health care. So we expect the numbers to increase. What happens? The health workers are overwhelmed, and now when the mothers come, they come to die in the hospital.
Right.
So much as we are improving coverage, we are now improving skilled birth, but we are not improving on the attendance. So they come to hospital, complications are coming up in the hospital, and we are not doing them any favor.
There's not enough people. How many doctors would you say have resigned so far?
So far from our database, we have, the last time we had about 112 confirmed, but that is a small number because that is what we got. But out there are many others who have just walked out, and we have not yet gotten their details. Now, I want to also say that because I really agree with most of what the PS is saying, because they are really trying in the ministry. The other day, they even did a very big gesture because we had them absorb for the first time in a very long time about 700 interns to come in, doctor interns who are going to work under supervision.
Right.
But you see, that is not solving the problem, because much as we are bringing in 700 interns and we are losing over 100 specialists, the work that is being done by the interns is completely different from the one that is being done by the specialists. So we are still having a problem which is not being solved, but we are just window dressing so that we can be able to say that we are doing something, much as the national government is trying to employ people, but we are losing them. So it looks like we are pouring water in a porous kind of vessel.
All right. There's perception that doctors are not happy working under the county governments.
Absolutely.
You can confirm this for us?
Absolutely. Yeah. Actually, that one I want to put it in black and white. Doctors are completely disillusioned. This move to devolve healthcare haphazardly, and it was done unconstitutionally. I want to say that because initially, I think the principle was that we have a devolved healthcare system which is going to meet the needs of the different regions. But the way it was done unconstitutionally, illegally, it has culminated in a very bad kind of a transfer of services, so that doctors find themselves in a very hostile environment. They are not able to discharge their duties. We are completely dissatisfied with the way devolution of healthcare has been done.
So what happens now? Because the people who suffer are the Kenyans, are the people in the hospitals, and you just mentioned that the ministry put out a good gesture to try and get the needs of the union involved. How is this being addressed? Because if this continues, we really could see it spiral out of control to the detriment of patients across the country.
Yeah, as a union, we have tried to warn against this haphazard and lackluster way of handling healthcare, being a very essential service. But unfortunately, the other major stakeholder, which is government, has not reciprocated.
As of now?
Yeah, as we talk, you know, when I talk of government, you realize that there are very many, we need a sector-wide kind of approach, a global approach from government. Because even if the Ministry of Health plays its part, and then say, for example, the devolution process defeats all the things that were intended to improve the sector, then we end up having a net loss. So we have even gone to the extent of even going on strike.
Yes.
Just to warn about the problems that are going to be seen if we continue handling healthcare the way we are doing.
I want to come to the strike in just a moment, but as of now, the county governments have actually, at least through the Council of Governors, they've dismissed claims over the resignation of these doctors. They've actually said, for instance, Isaac Ruto, the chair of the Governors Council, has said, for instance, Bomet has actually gained because some of these doctors want to go into the counties to carry out work there. So are your claims maybe... Are you not looking at this factor that perhaps they would rather go back to their counties and work there?
Okay, I don't really want to get into a back and forth with Isaac Ruto, because Isaac Ruto, when he falls sick, he goes to the private hospital. He does not know what it means to have a broken down public healthcare system. What he knows is politics. So he tries to bring politics into everything. What we have experienced, even Ruto himself, as he's speaking, he has actually mishandled doctors. He sent back about 11 doctors so that he can tribalize the delivery of healthcare in Bomet County.
So he gained and then sent them back, that's what you're saying?
He sent back doctors to the national level, he manhandled them, and in fact it is the Ministry of Health who tried to come in and redeploy some of these doctors. And we want to tell the likes of Isaac Ruto that doctors are highly professional people. You cannot handle them like that and expect them to stay there and work.
They're in Kwale right now.
Those are some of the issues that are actually even making doctors to resign.
We're moving.
The way they're being handled.
I want to move into the strike just now, but the governors are at the moment meeting in Kwale. What would you want to say to them? What is your message to them?
I think the governors should own up and just say that and agree that healthcare, the way it has been given to them, is too much. You know, it is a bit big for them. It is a big chunk they cannot chew. So what needs to happen is that we need to go back to the drawing board. They need to be magnanimous enough, feel the plight of their people, so that we can expedite. If at all we are going to devolve healthcare, then we need to expedite the process in the way that it was envisioned initially by the makers of the Constitution, as opposed to the haphazard way that it is
that
being
you feel
done.
It's been done. Let's move on to the doctor strike, and it has been painful in terms of impact. Some people say you're even going against the ethical code of conduct. Do you have any regrets?
Regarding strikes, actually, by the time you see doctors going on strike, then you should be able to know that it is a very desperate situation. Because sometimes doctors are faced with the situation where patients are coming in and they are dying before your eyes. You are just presiding over the deaths of people, cheating them that you are serving them when you are actually not serving them. So it gets to the point where you ask yourself, do I continue sitting here carrying out PR exercises, or do I now stand out and say, no, I am not going to continue doing this until you rectify the situation so that I can be capacity built to do my job?
But there are a lot of patients have died because of this strike. Isn't there anything else you could have done differently, that you could do differently, or will you continue to use strikes as a way of putting your message across, even though there are patients dying because of these strikes?
Believe me, Janet, I am one of the people who feel very bad when I see health workers abandoning hospitals, abandoning our patients in there, suffering, just because we want to put a point across. And most of the time, it is because we are putting a point across for these patients. Okay? Now, this is something that I wouldn't want to happen again. But you see, it calls for a lot of collaboration. First of all, we have to see health as a very essential thing. We have to acknowledge that health is an essential service, so that even the government plays its role. And then we forestall these things. Before we go on strike, usually we have exhausted all the other channels, and we have received no kind of positive response.
So even now, if there's another issue, we can expect doctors to go on strike if they feel that their issues are not being addressed. That's what you're saying.
Actually, Janet, as I can tell you, is we are trying to address some of the issues. From some quarters, and especially from the Ministry of Health, we have seen a lot of collaboration. And I want to actually acknowledge the role that is being played by the Cabinet Secretary, the PS in the Ministry of Health, in trying to resolve some of these issues. When the governors harass our doctors, they try to see how they can be able to resolve it. When we have our interns finishing, they try to see how they can deploy them on time. But it is not enough, because the rest of the government structures need to also play their part.
We were out of time. I have a final question for you. I know that the issues of the strike will probably have to revisit it later, but let's look at brain drain, because we have a lot of brilliant doctors working abroad. How can you make the health sector more attractive for them to come and bring their expertise back home?
That is not rocket science, Janet. All you need to do is motivate the doctors. Pay them well, because most of the doctors who are out there are economic refugees. They are looking for competitive pay. Pay them well, provide them with a good environment. Give them their tools of trade, medical equipment so that they can protect themselves, masks, gloves. Give them the medication they need to treat their patient. Give them the equipment that they need. Give them the environment they need. Because when you don't give them their tools of trade, when something goes wrong, you are the first one to rush to them and start telling them, now you are negligent, we are going to deregister you. You put them on the media there and you actually make them look very bad. It is not an attractive environment for anyone to work.
All right.
Yeah.
We'll have to leave it at that. Certainly a discussion that needs to be had again. That is the Secretary General of KMPDU, Sultan Matendechere, giving us his views on what's happening with regards to the health sector in Kenya, and linking that as well to devolution. Now, a casual laborer died after he was attacked by a buffalo at the Lake Nakuru National Park. Eyewitnesses say the attack occurred as the deceased, together with another man, fetched water from a nearby Nakuru water and sewerage and sanitation dam, as Zedi Kosgei reports.
Another case of human-wildlife conflict. Its latest victim, Peter Muregi Nyuthu, a casual laborer who sells peanuts to workers and tourists at the Lake Nakuru National Park.